I have another alginate tip for you guys, and this one is so simple, but you need to do it every single time you make an alginate impression. Let me show you what it is. So instead of directly placing this tray filled with alginate into your patient's mouth, take some of the excess alginate which you have and apply it to all the relevant areas which you need to capture. In this particular case, we want to capture all of the occlusal surfaces because this is going to be the counter impression or the opposing impression for a crown prep. So let's capture everything that we need. We apply it everywhere with your gloved finger, and then we do the impression. And here also you would ask the patient to relax the lips so that you get good anatomy of the border areas. So let's wait for this to set and see how we did.
A few moments later.
Okay, the alginate's all set. Let's see how we did. And you can see that we have a very nice impression. All of the occlusal surfaces are recorded perfectly, and that's only because we used the gloved finger with the alginate and applied it to the relevant areas. Do this for every single impression and you won't have a problem. Alright, I hope you found that simple tip useful, and I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.